Hey everyone, quick question before we get started. And I want you to really think about this one. How many times have you been intimate with someone you care about and afterward you could just tell she wasn't fully there? She smiled, she was kind, but something was missing. And you didn't know why? And honestly, maybe you were too afraid to ask. I've spent over 15 years as a physician working with couples and individuals on sexual health. And I can tell you right now, that gap between what men think women want and what women actually experience, it is one of the most common, most painful, and most fixable problems I see in my practice. My name is Dr. Lily Harper, and today I'm going to walk you through exactly what's happening inside a woman's body and mind during intimacy, and more importantly, what you can do about it starting tonight. I want to give a special shout out to all the folks watching from the Pacific Northwest, Portland, Seattle, Spokane. Thank you for the incredible support. You guys keep showing up, and I genuinely appreciate every single one of you. If you want to hear your city called out in my next video, just drop where you're watching from in the comments below. I read every single one. Now let's get into it. Here's the truth that most men were never taught. And it's not your fault nobody told you. Women's pleasure is fundamentally different from men's. Not better, not worse, just different. And if you're approaching intimacy the same way you did when you were 30, without understanding how a woman's body actually works, you're likely leaving a whole lot of satisfaction on the table. For both of you. Men's arousal is relatively straightforward. Physical stimulation, a bit of time, and the body responds. But for women, especially as they get older, pleasure is layered. It's shaped by physical readiness, emotional safety, mental state, rhythm, angle, pressure, and timing. All of it matters. And here's the part most guys don't realize. The physical stuff is actually the easier part to learn. The harder part, and the more important part, is understanding the full picture. So let me start at the foundation. A woman's body has several key pleasure centers, and understanding where they are and how they work will completely change how you approach intimacy. The three most important ones are the clitoris, the G-spot, and the area near the cervix. Let's talk about the clitoris first, because this is where most men get it wrong. About 70 to 80% of women reach orgasm through clitoral stimulation, not penetration. That number might surprise you, but it's been confirmed in study after study. The reason is simple. The clitoris contains more than 8,000 nerve endings, which is actually more than the tip of the penis. It is the most sensitive structure in the human body, full stop. So, when men focus almost entirely on penetration and skip past clitoral stimulation, they're essentially skipping the part of the experience that matters most for her. The G-spot is located on the front wall of the vagina, roughly 2 to 3 inches in, toward the belly button. It has a slightly different texture than the surrounding tissue. A little firmer, a little ridged. When stimulated with consistent, gentle pressure, it produces a very distinct and deep kind of pleasure. But here's what people get wrong about the G-spot. Jamming or poking at it doesn't work. It responds to sustained rhythmic pressure. Think pressing and holding, not rapid in and out movement. The area near the cervix, sometimes called the A-spot, is further back and deeper inside. For some women, stimulation here produces extremely intense sensations. For others, it feels uncomfortable or even painful. This is one of those areas where individual variation is huge, and you absolutely need to pay attention to her responses. Never assume deeper is better. Always check in. Now, before we even get to penetration, I want to spend some real time on what happens before, because this is the step that most men rush through, and it's the single biggest reason women end up feeling physically and emotionally disconnected during sex. I call it readiness, and it has two components: physical and psychological. On the physical side, a woman's body needs time to prepare. When she's genuinely aroused, the vagina naturally produces lubrication, and the tissue becomes more sensitive and responsive. If penetration happens before that process is complete, it doesn't just feel uncomfortable. It can actually cause pain, micro tears, and a stress response that shuts down arousal entirely. So, if you're moving too fast because you're ready, understand that her body is on a different timeline, and that's not a flaw, that's just biology. The good news is, you have a lot of influence over how quickly she gets there. And that leads me to the psychological side of readiness. Women's arousal is deeply connected to emotional safety. That's not a cliche, it's neuroscience. When a woman feels anxious, unsafe, self-conscious, or emotionally distant from her partner, her nervous system activates a stress response that physically inhibits arousal. The body cannot be both on guard and fully open at the same time. Those two states are mutually exclusive. So what does that mean practically? It means the way you show up before you're even in the bedroom matters enormously. Are you present with her? Are you making eye contact? Are you being kind and attentive? Small things, a genuine compliment, a moment of real physical closeness like holding her hand or a slow hug, a quiet conversation where you're actually listening. These things lower her nervous system's defenses and allow her body to begin moving toward arousal naturally. In my practice, I've worked with couples where the man was technically skilled in the bedroom but emotionally absent in daily life. And in nearly every one of those cases, the woman reported low satisfaction and disconnection during sex. The fix wasn't a new technique, it was emotional presence. That's where it starts. Now, when it comes to physical foreplay, there are 3 things I want you to focus on. First, psychological safety. We just talked about this, but I want to bring it into the physical space as well. At the start of intimacy, slow down deliberately. Don't rush. Let your touch be curious rather than goal-directed. Women can feel the difference between a man who's racing toward penetration and a man who's genuinely present and enjoying the experience of being with her. That presence is incredibly attractive, and it's one of the things that naturally builds arousal. Second, check for physical readiness before moving forward. I know this might feel clinical, but it doesn't have to be. A gentle touch, paying attention to her body's response, asking softly, "Does that feel good?" These are intimate, connected moments. If she's not yet physically ready, that's not a problem. Just keep going, slow down even more, use lubrication if needed. There is absolutely nothing wrong with that, especially as both partners get older and natural lubrication may decrease. Third, use your words, your eyes, and your touch together. Women's arousal is multisensory. Telling her she looks beautiful, maintaining eye contact, kissing her slowly, running your hand along her back. These aren't just romantic gestures. They're physiological triggers that activate her arousal system. Saying something like, "You look incredible right now," or just whispering her name and looking at her, these things matter more than most men realize. Once she's fully ready, and I mean actually ready, not just ready enough, penetration can begin. But here's where I want to reframe something for you. Penetration is not the main event. It's the continuation of an experience that started long before. The moment you mentally shift from, "Now we're really doing it," to, "This is all one connected experience," your entire approach changes, and she will feel that shift. So let's talk about movement, specifically rhythm and tempo, because this is where most men default to what feels good for them without realizing it may not be what feels best for her. The most common mistake I see is men defaulting to fast, hard, repetitive thrusting. And I understand why. That's what tends to feel most intense for men. But for women, especially in the early stages of penetration, fast and hard often produces friction, discomfort, and a decrease in arousal. It's the opposite of what you want. Instead, start with what I call slow and deep. This means moving slowly, fully, and deliberately, letting the motion itself carry the sensation rather than relying on speed or force. This technique is particularly effective for G-spot stimulation because it gives the nerve-rich tissue time to respond. When you go slow and deep, women tend to feel the fullness of the sensation rather than just the surface stimulation of rapid movement. Take your time. Don't rush this. The second technique I recommend is what I call the wave. Instead of a consistent, monotonous rhythm, you vary the depth and intensity of your movements in a wave-like pattern. Start shallow, just the first inch or two, with slow, repetitive strokes. Then gradually deepen the motion over several minutes, then pull back to shallow again. This variation keeps the nervous system engaged and prevents the body from habituating to the stimulation, which is what causes pleasure to plateau and fade. The wave keeps things building. The third technique is counter rhythm. This one requires you to pay attention to her body. When a woman is aroused and engaged, she will often begin moving her hips, pressing towards you, rocking, adjusting. Most men either ignore this or accidentally work against it. Instead, sync with her. When she pushes forward, meet her. When she slows, you slow. This creates a sense of unity that amplifies the physical sensation for both of you. Women often describe this as feeling in sync, and that feeling is both physically and emotionally powerful. Now let's talk about angle, because this is something almost nobody talks about, and yet it makes an enormous difference. The vaginal canal is not a straight line, and the most sensitive areas, particularly the G-spot, are positioned in ways that require intentional adjustment to stimulate effectively. The first angle adjustment to know about is forward tilt. When the woman's hips are slightly elevated, using a pillow under her lower back, for example, the angle of penetration shifts so that the tip is more likely to make consistent contact with the front wall of the vagina, where the G-spot is located. This is one of the simplest, most effective changes you can make. A folded pillow. That's it. Try it if you haven't. The second adjustment is lateral movement. Instead of a strictly in and out motion, add a gentle side-to-side rocking or circular motion. This broadens the area of stimulation inside the vaginal canal and introduces new sensations that straight thrusting can't produce. You don't have to do this constantly. Even brief moments of lateral movement interspersed with your usual rhythm can significantly increase her arousal. The third thing to know is that angle is not one size fits all. What works for one woman may not work for another. The position of her legs, the angle of her hips, the natural shape of her anatomy, all of these things affect where sensation is concentrated. So rather than locking into one angle and staying there, allow yourself to explore. Make small adjustments, watch her face, listen to her breathing, and follow the feedback her body is giving you. Her body will tell you what's working if you're paying attention. Now, I want to share 3 advanced techniques that I teach in my practice for couples who want to take things further. The first is stop and go. This is exactly what it sounds like. During penetration, you deliberately pause. Go slow and deep, then stop. Hold that position for 3 to 5 seconds. Then begin again slowly. What this does is prevent the body from habituating to the stimulation. When you stop, her nervous system essentially resets, and when you begin again, the sensation feels new and intensified. This is especially effective for prolonging the experience and building toward a more powerful finish for both of you. The second technique is depth variation. This means deliberately alternating between shallow and deep penetration within the same session. Spend a few minutes in the shallow range, where the clitoris and the first portion of the vaginal canal are stimulated, then shift to deeper, fuller movement, then come back to shallow again. This creates a dynamic experience rather than a single note one, and it engages multiple pleasure zones in a single session. The third technique is pressure modulation. Instead of relying solely on movement, use varying degrees of pressure. At certain moments, press inward and hold, not thrusting, just sustained pressure. Then ease back. This kind of stimulation is very different from movement-based pleasure, and many women find it deeply satisfying in a way they've never experienced before. It also slows the pace of the encounter and reinforces that sense of presence and connection I talked about earlier. Now I want to spend a few minutes on what not to do, because avoiding these mistakes is just as important as learning the techniques. Number 1, starting fast and hard. I can't say this enough. Starting with intense, rapid movement before her body is fully ready almost always produces discomfort rather than pleasure. Even if she doesn't say anything, and many women won't because they don't want to hurt your feelings, her body will tighten, her arousal will stall, and the experience will be far less satisfying than it could have been. Always start slow. Always. Number 2, staying in one rhythm for too long. The nervous system adapts to repeated stimulation. If you maintain the same speed, depth, and pressure for too long, the sensation literally decreases. Variation isn't just nice to have, it's biologically necessary for sustained arousal. Change your rhythm, change your depth, change your angle. Keep her nervous system engaged. Number 3, ignoring her responses. This one is the most important. Sex is a 2-person conversation. And if you're so focused on what you're doing that you're not reading her responses, You're missing half the information you need. Watch her face. Listen to her breathing. Feel how her body is responding beneath you. If she seems tense, if her breathing is flat, if she's gone quiet in a way that doesn't feel like pleasure, something isn't working. Adjust. Don't power through. This brings me to one of the things I feel most strongly about: learning to read her body. A woman's body gives constant feedback during intimacy. Once you learn to read it, everything changes. You stop guessing. You stop wondering if she's enjoying herself. You just know because you're actually paying attention. Here's what to look for. Listen to her voice and her breath. As arousal increases, breathing naturally deepens and quickens. Her voice changes. It gets softer, or she begins making sounds she wasn't making before. If her breathing is flat and controlled, and her voice hasn't changed at all, she's not fully aroused yet. Don't interpret silence as satisfaction. Keep working with her, not at her. Watch her hands and her legs. When a woman is genuinely turned on, her body responds involuntarily. Her fingers may curl or grip, her thighs may tighten, her hips will begin to move toward you rather than remaining still. These are all positive signs. Conversely, if her legs are rigid and held tightly together, if her hands are flat and still, if her body feels braced rather than open, she may be uncomfortable or checked out. Check in with her gently. Ask directly, but do it softly and naturally. You don't have to break the mood to ask, "Does this feel good?" A quiet whisper in the middle of things, "You like that?" or "Is this okay?" is intimate, not clinical. It shows her you're paying attention, and her answer, whether in words or in the way her body responds, is genuinely useful information. Use it. Now, I want to talk about something that I believe is the deepest layer of all of this, and something I think gets overlooked in almost every conversation about sex and intimacy. No matter how technically skilled you are, if she doesn't feel emotionally cared for by you, she will not be fully present during sex. That is not a criticism. That is just how women are wired, neurologically and emotionally. The emotional safety we talked about earlier doesn't just apply to the moments before sex. It applies to the relationship as a whole. Women who feel seen, appreciated, and valued in their daily lives with a partner are far more likely to be open, relaxed, and responsive in the bedroom. Women who feel taken for granted, dismissed, or emotionally disconnected tend to be physically guarded, even if they're willing to have sex. So if you want to improve your intimate life in a real, lasting way, the work starts outside the bedroom. Make eye contact during ordinary conversations. Remember things she told you. Express appreciation, not just for what she does, but for who she is. Physical affection outside of a sexual context, a hug in the kitchen, a hand on her back when you're walking together, sitting close to each other on the couch. These things build the reservoir of trust and warmth that makes real intimacy possible. I know this might sound less exciting than a list of techniques, but I promise you, in 15 years of working with couples, the single most consistent predictor of a satisfying intimate life is not technique. It's emotional connection. That's the foundation everything else is built on. After intimacy, what you do in those first few minutes matters more than most men realize. Don't roll over and fall asleep. Don't reach for your phone. Stay present. Hold her. Let the moment breathe. A simple, "That was really good. I'm glad we have this," goes a long way. Women process intimacy emotionally as well as physically, and the afterglow, that soft, warm space right after sex, is when she feels most open and most connected. Be there for it. It costs you nothing, and it means everything to her. Here's what I want you to take away from all of this. Great intimacy is not about being the most technically skilled person in the room. It's about being the most present. It's about understanding her body, the clitoris, the G-spot, the nerve-rich tissue that responds to slow rhythm and intentional pressure. It's about building emotional safety before you ever get to the bedroom. It's about reading her responses in real time and adjusting to what you find. And it's about staying connected after, honoring the experience you just shared together. The techniques I've shared today, slow and deep, the wave, counter rhythm, stop and go, depth variation, pressure modulation, angle adjustment, all of these are real, effective, and learnable. But they work best when they're delivered by someone who is emotionally present, paying attention, and genuinely invested in her experience. You have more capacity for that than you might think, and it's never too late to learn. If this video was helpful to you, please leave a like and share it with someone who might need it. Drop a comment and tell me where you're watching from. I love knowing where my community is located across the country. And if there's a specific topic you'd like me to cover in a future video, whether it's about communication, physical changes that come with aging, or rebuilding intimacy after a long gap, let me know. Your questions guide what I create. I'm Dr. Lily Harper. Take care of yourselves and take care of each other.